Bullshit. Bullshit. Bullshit.
Bullshit.
A bullshit?
This week, the Centers for Disease Control made a sneaky change to its website.
The CDC's new language regarding vaccines and autism.
There's a statement that says the claim, quote, vaccines do not cause autism, end quote, is not an evidence-based claim because studies have not ruled out the possibility that infant vaccines cause autism.
This new webpage that reads studies have not ruled out the possibility that infant vaccines cause autism. Studies supporting a link have been ignored by health authorities.
But that's bullshit.
There is a substantial amount of evidence that shows that there is no link between vaccines and autism.
It's actually worse than that. It's dried up 27-year-old bullshit.
There was a 1998 article that proposed a link between childhood vaccines and autism that has been serially debunked.
That's right. This all goes back to a 1998 paper by Dr. Andrew Wakefield, published in the British medical journal The Lancet, claiming that there was a link between the vaccination for measles, mumps, and rubella, the so-called MMR vaccine, and a child's risk of developing autism. But it turned out that the 12 children that Wakefield studied were carefully selected, and some of his research was funded by lawyers involved in lawsuits against vaccine manufacturers, and The Lancet retracted the article, and since that time, the article has been debunked again and again and again. In just one example, in April 2015, the Journal of the American Medical Association published the largest study ever done to that point, analyzing the health records not of 12 children like Wakefield did, but of 95,000 children. That study confirmed that the MMR vaccine did not increase the risk of autism, and since then, there have been even larger studies.
Over 5 million participants, that's how large these studies are, show continuously over 40 different states that there is no association between vaccines and autism.
So, did anything new happen that would cause the government's official agency for fighting disease to change its medical guidance?
Is there any new information that you're aware of?
No.
Actually, it's the opposite.
We've designed vaccines in such a way that we're asking less of our immune systems. If anything, vaccines have improved. Their safety profiles really are impeccable.
What's really going on here is just the next step in a process that's been unfolding all year for RFK to achieve his true goal, vastly dialing back Americans' access to vaccines, particularly for children. First, RFK Jr. gave some assurances during his confirmation hearing to become U.S. Secretary of Health and Human Services.
If the data is brought to you, will you say, I see this, and I unequivocally and without qualification say that this does not cause autism?
Not only will I do that, but I will apologize for any statements that misled people otherwise.
Well, guess what end of a bull that came out of, because 4 months later,
Secretary Robert F. Kennedy Jr. is ousting all 17 members of the Advisory Committee for Immunization Practices.
he not only fired all the members of the panel that advises the CDC on vaccines, he replaced them with anti-vaccine conspiracy theorists. And finally, RFK Jr. announced that he wants to re-examine the use of all childhood vaccines, period. And the thing is, this is all bullshit, because RFK has admitted that he doesn't care what the science actually says. Look at the testimony of Dr. Susan Menares, who served as the director of the Centers for Disease Control before Kennedy fired her in August.
I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
RFK has been on a continuous quest to find a way to make a link between vaccines and autism, and he keeps trying to come up with reasons, and they all have one thing in common.
At first, it was the MMR vaccine.
Bullshit.
They said then RFK Jr. wrote an article in Rolling Stone magazine saying it was the thimerosal preservative that used to be in vaccine.
Bullshit.
Then it was the HPV vaccine.
Bullshit.
And then it was spacing vaccines too close together.
Bullshit.
Or aluminum vaccine.
Bullshit.
Each time the scientific community's debunked it.
There are two problems here. One of them is public confusion.
This means for all of us is that we can't trust the CDC anymore. They are not a scientific or public health authority.
The second is that the confusion is directly hurting kids.
We're seeing a decrease in vaccination rates. This year we saw 45 outbreaks of measles at least. That's triple the number we saw last year. Over 90% are unvaccinated.
Disease killed a 6-year-old in Texas, the first death from measles in the U.S. in a decade. And then an infected adult died in New Mexico. Both were unvaccinated. Measles is one of the most contagious diseases in the world. We have a vaccine that is 97% effective in preventing it.
Look, I'm a dad, and this stuff is scary for all of us as parents. Some of the people who worry about vaccines are coming from a place of genuine concern. When I was a state legislative staffer, the statewide head of the anti-vaccine group was an amazingly pleasant woman who could remember all of my children's names, even brought a little present when my second kid was born. I'm certainly not saying that concerned parents are evil, but I am saying that the head of the United States government agency in charge of protecting our health is actively working to lie about science, to take away access to vaccines, and ultimately to hurt American children because of his own personal fantasy vendetta. And that is bullshit.